Alright, today we're starting with an exam of the foot and ankle. We're going to mainly be focusing on the ankle today. This is a very basic exam and what Dr. Cruz would want you to know when he has a patient presenting for an ankle or foot complaint. Typically with this exam you're going to follow your classic rules of starting with inspection first. Things I like to look for with an ankle is any areas of swelling or deformity. If they're having a foot complaint, they may have changes down in the foot as well. So you basically just want to get an idea of where their symptoms are coming from. Next step would be to palpate the area where the tenderness is. A lot of times this is going to be along your joint line, but typically you let pain be your guide when palpating the patient. Following those two steps, our third thing that we'd want to do next is then have them do active range of motion. So what I like to have the patient start with is starting with dorsiflexion, bringing the foot up, then plantar flexion, bringing it down, inversion, bringing the foot in, and then eversion, followed by circumduction. You obviously want to compare this to your other side to look for any deficits or changes in their range of motion. Following that step, I then like to do these things passively, as you may pick up tenderness or pain doing those exact same ranges of motion, but when you're taking the patient through the motion with your hands. Following that, the next step is testing their strength to make sure there's no deficits in that. So we're going to have the patient go up into dorsiflexion here. You're going to pull as hard as you can. Next step, they're going to go into plantar flexion, pushing you away, followed by inversion. They're not going to allow you to move their ankle here. Perfect. And then up into the out. Over here in eversion, and they're not going to let you push them away. Those are the main basic tests of the ankle. Now we're going to get into some specialized tests. Mainly this is going to focus on when the patient has had an ankle sprain. The first one you'd want to do is called your anterior drawer test, which is going to stress the ligaments of the ankle. Typically you start by stabilizing their tibia, then your bottom hand is going to grip onto the heel, and you are going to slightly give forward traction, trying to stress those ligaments, seeing if this recreates their pain. A second step you can do is bringing them into a little bit of inversion to put a little bit more stress along the ATFL ligament, which is the one that is most often injured with an ankle sprain. The next test that we like to also do is the Taylor tilt test, which kind of checks their motion at the heel. What I like to do is grip the patient along the heel. That helps stabilize. Then I use 2 fingers to palpate along the outside portion here. And what you're doing is just doing a slight rocking motion back and forth to see how much motion they get of that subtalar joint. Following those tests, a patient may have a complaint that is concerning for a high ankle sprain. So testing the syndesmotic ligaments in the front is a very important part of our basic exam. Typically when you're starting in this area, you want to first start by palpating along that syndesmotic area and down into the ligament, which is right here where my thumb is. If they have pain with that, another test that you can do is called your squeeze test. You're going to place their fibula and tibia between your 2 hands, and you're going to squeeze, with pain being reproduced down here at the anterior portion of their syndesmotic ligament. The last test that can help you distinguish if they have a high ankle sprain is taking the patient up into dorsiflexion with eversion stress. This loading of that joint will then recreate pain along the anterior aspect of their ankle and can be a very good test for high ankle sprain. This is a very basic introduction. For further tests and understanding of things that you can do at both the foot and ankle, we'd recommend following up with BGSM videos online.